And congratulations on having your vasectomy. This is real quick for post-operative instructions. I'm going to prescribe to you some ibuprofen and some Percocet and some stool softener. And that's basically it. Uh, the stool softener, just so you know, you may not think you need it. Every single person who has a procedure done on their pelvis gets constipated. So I know it sounds crazy, but this is kind of not the time you want to strain. So I would just take that until you're sure that you're not going to get constipated. Otherwise, the pain medicines seems self-explanatory, although I would recommend taking the ibuprofen round the clock. Go ahead and take that at least 3 times a day. It's 600 milligram Motrin tabs. Take those 3 times a day, and then you can take a fourth if you really need to. And then you do have a few Percocet just in case, just so you know, the Percocet is going to make you drowsy and you can't operate machinery or anything like that while you take the Percocet. People talk about peas and ice and everything. If you want to do that, that's probably helpful. It may not matter. If you want to ice it down with a bag of peas, in the first 24 hours, that's probably fine. One thing you do probably want to do is provide support. So, if you're in a chair or whatever, you can put a little towel under there to get it raised up, and that'll really help with the swelling. And the other thing to do is when you're up and walking, actually wear briefs, not boxer briefs, just straight briefs. And usually we say one size too small in the post-op setting. So you just put those on and, for the first few days or so to really give support and prevent the swelling from happening. The swelling generally happens within 2 to 3 days and that's it. But what happens is if swelling does occur, then that area tends to hang low, as we know. And so getting fluid back out of there can be a little bit challenging. So preventing it with support and stuff like that can be helpful. You're also going to go home with a small container for your semen analysis and a label. So that's for 3 months from now. So don't forget, in 3 months, go ahead and do that. Bring it into the lab. It should be good to go. I don't schedule a necessary post vasectomy visit. If you would like a visit, of course, just call. We'll get you in right away if there's any issue at all. But otherwise, you should be good to go. Once your semen analysis comes back, you'll get a call saying, okay, this looks good. And that's that. So yeah, if you do have any questions, feel free to call the office.